According to the Alzheimer's Society of Canada, dementia is not a normal part of aging, but age is the biggest risk factor. And with Canada's population graying by the minute, it's expected that in just 15 years, as many as 1 million Canadians will be diagnosed with dementia. What can be done to treat, prevent, and assist families and caregivers dealing with this? Let's ask Dr. Samir Sinha, Director of Geriatrics, Mount Sinai Hospital and the University Health Network, William Reichman, President, CEO of Baycrest Health Sciences, and Debbie Benczkowski, Chief Operating Officer with the Alzheimer's Society of Canada. And it's great to have you three around our table here at TVO tonight. Let's share some facts that the three of you know all too well with our audience. Sheldon, if you would, there we go. Canadians with dementia. More than 500,000 people in this country are currently living with dementia, of which 16,000 are actually under the age of 65 years old. But fast forward 15 years, and that number is expected to jump to almost 1 million. Just some basics here, Dr. Sinha, before we start. The difference between Alzheimer's and dementia, what is it?
It's a very common question, and the key is dementia really is an illness where your memory and other forms of cognition are interfering with your ability to do your daily tasks. And people say, well, at least I don't have Alzheimer's, right, if I have dementia, but Alzheimer's is the most common type of dementia. There are upwards of 90 to 100 types of dementia that have been classified, but Alzheimer's is the one that's the lion's share of the dementias that exist.
Gotcha. Debbie, we're talking Alzheimer's Awareness Month, obviously. It's a good opportunity to learn more about this issue. You have to find something to focus on, I guess, every year, a little bit different to get people's interest. What are you focusing on this year?
This year, our Alzheimer awareness campaign is hashtag In It For All. So what we really want to do is we want people to learn more about the disease. We want people to advocate for dementia-friendly communities. We want people to support research. We want people to be a dementia friend, so help people to live in their homes and in their communities for as long as possible before having to go to long-term care. So it's a social media campaign primarily, but we want people to really focusing on the person with dementia.
Every great cause wants more attention. We know that. Why do you think it's particularly important that Alzheimer gets more?
Well, because of the numbers you just showed, obviously, we know that that's a huge issue. We know that there's great cost to our healthcare system. We know there's great cost to people with dementia and their caregivers. Caregiver burnout is a huge issue that, we need to support people that are living with that burden in their lives. So many, many reasons, even at the World Health Organization level, they're calling for dementia to be a national priority in countries around the world.
I know this is all a professional mission for all of you, but usually people have got a personal connection to it as well. Do you have a personal connection?
I do.
What is it?
My grandparents, who put me through university and medical school, all suffered from Alzheimer's disease. So I lived as their primary caregiver for years. And then, of course, on the professional side, I found it to be particularly interesting area to pursue medically.
How about you?
Yes, I had my mother passed away from vascular dementia in the summer, and my mother-in-law had Alzheimer's disease.
You've seen it up front and
Seen
personal.
it up front and personal, yep.
Dr. Sinha?
When I watched my grandfather, I started hearing stories from the family about how he was doing in India, and I thought, I think he's got dementia, so I flew out and saw him, and indeed that's what he had. And the challenge there was little awareness about what that illness was.
We're going to show, if you just look at the monitor straight ahead, we're going to show a picture of a normal brain and then contrast that with one with dementia. And Samir Sinha, let's go to you first. Can you just tell us sort of what the most striking differences are between the left side and the right side in this picture?
I hope my colleagues, my neurology colleagues, aren't watching my interpretation, but really, this is a really nice image showing a healthy brain, on the left, and as you see, a brain that's obviously more shrunken in particular. And that's one of the hallmark features of dementia. You often see that the brain is smaller in size. You see bigger holes, and those are small pockets that become widened as the brain actually shrinks. And then certain parts of the brain, the hippocampus, which is a structure towards the bottom, center part of the brain there, that actually starts to shrink quite a bit. And that's often seen as a key feature in dementia, especially when it's important for your memory.
William Reichman, that brain we saw on the right with all the problems associated with it, can all of those problems be treated?
So the symptoms of Alzheimer's disease, as Dr. Sinha said, the primary cause of dementia can be treated with medication. But the effect of these medications is what we kindly call as modest. So we can improve a patient's awareness, their attention, but the improvements are relatively short-lived. In many patients, there are also changes in their emotions or their demeanor. They may be resistive to getting care assistance, and we have medications that can help with that, as well as with things like anxiety or depression or sleep disturbance. But there are no medications that can reverse the kind of damage that Dr. Sinha just talked about, the atrophy which goes along with diseases like Alzheimer's.
So essentially, you can make things less worse or worsen slowly, but you can't improve anything.
Well, we can improve patients' functions, but generally that's a transient effect of this generation of medications.
Are you, okay, put us on a scale from 1 to 10 here. 1 being you're nowhere, 10 being you've got the cure. Where are we?
Well, that's a highly subjective impression, but I would say right now we're probably at around 5. I think that we've got a long way to go. We've learned quite a lot in the last couple of decades, but the reality is over 99% of drugs that have entered the really pivotal clinical trials, what are called phase 3 clinical trials, over 99% of those drugs have failed. And what that tells us is that there is still much to be learned about why this disease occurs in the first place, and what the right targets are with regard to the pathology in the brain that causes the symptoms, what the best targets are for treatment.
He's got us at 5 out of 10. Where do you put us?
I'd agree. I'd say a 5, because right now there are many different types of dementia, right? And certain drugs and certain treatments that are being created are meant to target certain theories behind why we have dementias as well. But as Dr. Reichman was saying, we've been seeing lots of these trials where we had a lot of hopes around, and some people are saying maybe the good thing about some of these trials, it'll help us abandon bad paths of thinking, go on for new paths of thinking. But we do know that there are some things we can do that can prevent dementia, and we have to emphasize those at the outset.
Before we get to those, is there any treatment path or test path that you're on right now that you find really encouraging?
Right now, what I always encourage is make the diagnosis, allow patients and families to take control of their situation and support them, because that's really what we can do. We don't have a cure. We don't have medications that can modify the disease, but through awareness and support, we can at least allow people to lead more fulfilling lives.
Is there a stigma associated with Alzheimer's disease and dementia?
Yes, definitely there's a stigma, and so that's one of the things that our Awareness Month campaign hopes to fight against the stigma. One of the things, of course, as I already said, about Dementia Friends and dementia-friendly communities, because that really does support people to be independent in their communities for as long as possible. So stigma is an enormous issue that we try to bring awareness to all the time.
Just fill that out a little more. It's stigmatized because what? Nobody wants to be with them,
I
or
think
what?
people I think are afraid. I think they're afraid when you hear you have a diagnosis. There's fear. There's the unknown. So important that we create awareness, people understand what the warning signs are, because when you know more about something, you tend to be less anxious and less worried about it. So creating awareness is really important to help fight the stigma.
It's taken mental health, decades of efforts
Absolutely.
to get to the point, and there's still a ton of stigma around it, but at least we're getting a lot better these days
yeah,
at it.
yeah.
Are we there with mental health, with Alzheimer's and dementia yet?
No, we're not there yet. We still have a long way to go. But as I said, helping people to live in their communities as normally as possible for as long as they possibly can is, helping people to be a dementia friend. How can you help someone who's shopping in the grocery store and has had difficulty making change at the end of, when they're checking out with their groceries? How can you be understanding and help people? So just those kinds of little things. Be a dementia friend, be caring, be compassionate, understand, listen. Those are really important things that we can help people to live a better quality of life.
As a rule of thumb, everybody talks about living in their own home as long as possible, regardless of how bad your health is. If the idea is we can keep people at home longer, that's supposed to be better. Is that the case as well if you're suffering from dementia?
Well, I think that staying at home is what most people desire. But where potentially it's problematic is when people are staying at home, but they're staying at home alone. And so they're no longer connected to their communities. They no longer get the benefits of socialization. If there's one thing we know about how best to thrive as people, we need to be connected to other people. And many folks who are staying at home with dementia have very limited contact with other people, with the exception of perhaps a family member who can come visit, or maybe a paid companion.
Is it dangerous to be at home if you've got dementia?
Well, this is the key. I think, as Bill was saying, that we want to make sure that people who are living with dementia are supported. And so having someone who's living with you is great, because as your dementia progresses, you may make mistakes in terms of your function. You may not be able to, bathe yourself or cook your own meals yourself, and that could lead you to errors. Sometimes I think part of the stigma and the challenge is that we often say, oh, well, you have dementia, therefore you shouldn't do anything at all. And that's not quite the case. But at the same time, we have to make sure that people who do want to live alone are doing so as safe as possible. And when they are in situations where they need more supports, maybe a more supportive environment may be appropriate, or finding ways to get them out of the house to get some social stimulation through a day program can be another way to support them as well.
Obviously, if you have this condition, it's tough. But we've had numerous people on this program on the past who are the caregivers of those who have it, and it's you almost get the sense it's equally as tough on them. You've been through this, right, with your own family?
Yeah.
What does it do to the caregiver?
Well, it's very stressful on the caregiver, and we do see caregivers who have to deal with the effects of depression, and it really affects on their own health just because of the burden of caregiving and how challenging it can be.
How about in your own situation with your folks? How
Well, in
was
my
it?
own situation, I was caregiving remotely, so I was traveling every weekend to see my mother.
Because you're here.
As I'm here,
and
my
they were in
mother was
Buffalo.
in Buffalo. So I was traveling back and forth every weekend. I still do to see my dad, but it's a little different situation. But yeah, so it was very challenging because when you're working and traveling one full day, you have Saturdays at home and that's it. So yeah, and it was hard on my dad. So my dad, who is 96, very difficult for him as well. And he was trying to care for my mother as best he could.
Your grandparents, whom you dealt with, who had dementia.
That's correct.
What did it do to their personalities as you knew them once the diagnosis was there?
So both my grandfather and my grandmother showed a particular behavioral feature which is quite common, and that we call disinhibition. So sort of the social filter, the comportment started to fray. So both of them, depending on the circumstance, would say things in public aloud that normally, even if we think such things, we wouldn't say them.
Profanity?
So it could be profanity. It could be inappropriately jocular, making jokes at the wrong time. It could be commenting on someone's appearance in a way that's not particularly flattering. So both of them showed that kind of behavioral symptom. And I think it relates also to the question that you asked before about stigma. I think part of what contributes to stigma as well is the embarrassment that family members will experience when a loved one is behaving in a way that's not deemed socially appropriate. And that can cause a lot of distress, quite frankly, for spouses, for adult children.
When your grandparents were exhibiting that kind of behavior, did people in the extended family say to them, Grandma, you can't say that, or you've got to stop that, or how did they handle it?
Yeah, so I think it depends on the individual and their comfort level in addressing, and it also depends on how public it is, right? The setting in which it occurs. But no, I think that gentle reminders like Grandpa not so loud, taking Grandma by the arm and distracting her, getting her onto a different subject. Those things are generally quite helpful. The other feature, though, which can also be quite disabling to families, and which I experienced with my grandmother, was that some patients will demonstrate a suspicious nature, even if it wasn't part of their personality before the illness. So my grandmother did start to accuse me of misusing her money, of taking her money, of being up to nefarious deeds. And this wasn't only my experience. This is the experience of other families as well that have to deal with this. And that can, as you can imagine, be also quite distressing for caregivers who are expending so much of their emotional time and energy to care for this person, and yet they then get confronted with being up to no good.
Do people get that that's the disease talking and not, quote unquote, really them?
When you say people, do you mean like lay people that are around the patient or the patient themselves?
I suspect the patient doesn't realize what's happening to themselves. But for example, your extended family, when the behavior of your grandparents would change, was there some understanding of the fact that this isn't really Grandma and Grandpa, it's the disease talking?
I think so, yes, I think so. I think that, that folks recognize that it's either a significant coarsening of a personality trait that was always there, but now it's just so much more overt, Or if it's totally out of character for the person, yes, I think most sensible people would recognize this is not really grandma anymore. This is somebody who I don't even recognize in terms of the way they're relating to me and perhaps other people.
Let me get Samir Sinha to follow up on that, because I suspect, again, with the stigma we've talked about and the awkwardness of kind of not knowing how to treat somebody who's got a serious case of dementia. What do you do when you're with somebody who's got dementia? How normally are you supposed to act? How much pushback should you do against what we would consider to be antisocial behavior? Can you give us some help on that?
Well, part of this, part of what we've just been talking about are some of what we call the behavioral and psychological symptoms related to dementia. So when people think about dementia, they think it's just about memory. And then they start experiencing some of these symptoms, the paranoia, the disinhibition, maybe the repetitive vocalization. My grandfather in particular, he would just ask every 20 minutes, when's lunch? When he had lunch an hour ago, for example. That drove my aunt nuts, for example. And these are just some of the common things that happen. And I think
But let me just jump in. When Grandpa says every 20 minutes, when's lunch, should we be saying, you had it 20 minutes ago, you had it 40 minutes ago, you had it an hour ago?
And this is the key. So what I often do, and I think what's really important for caregivers, but also members of the public, is just to understand that this is actually all related to dementia. That trying to correct things, trying to say, actually, no, you had lunch an hour ago, it's not going to help because they're not going to remember. They're just going to continue asking.
So what do you do?
So the techniques, for example, in this case, my grandfather is very skinny, and I actually said, this is great that he's asking for more food. Just give him smaller samples. Just give him smaller meals. Or, for example, I say to families and friends that if you're experiencing some of these things where they're saying, the sky is green, there's no point in fighting. Only do the battles that actually matter when there's a safety issue at risk. Otherwise, learn to roll with it. And when people get that sense, they can relax a little bit. They realize they don't have to be correcting. They can try and be themselves, and they can understand sometimes this is just the disease and it's not personal.
But it's hard because you have to patronize your parents, grandparents, people you've probably respected your whole life. And suddenly now, facts don't matter anymore.
Well, I think this is the challenge, right? I think as folks have been saying, when you've seen a loved one, when you've known that person for your entire life, when you've been married to that person for decades, and now you see them changing, and you realize that the strategies to cope with this sometimes mean you don't pick battles, you just try and say, no, that's okay. Yeah, that can be something. There's sometimes guilt. There's sometimes other emotions that come with that. But I think this is some of the training that the Alzheimer's Society, other programs at Baycrest, at Sinai that we do with caregivers, just because when they feel better coping and better prepared, they're better able to, to care for their loved ones with dementia.
Debbie, in your mother's case, did she lose her memory?
Yes, she did lose parts of her memory. So she didn't lose her long-term memory. She still retained a lot of her childhood memories. But, for example, she would forget what she had for lunch. She would forget that she had lunch, which often happened. And so, what I think is the most important thing is that you try to meet the person where they are in the moment. You stay in the moment with them. So often I would, because I only saw my mother once a week, I would want to go in and tell her things. She was my mother. I wanted to share important things with her. And I'd get there, and the only thing she was worried about was, oh, am I going to have a bath today? Oh, I haven't had my lunch. So, you have to let those kinds of things go. And there's some sadness in letting those things go. But most important is to respect the person at the point where they are in that conversation. So I had to let those things go and meet my mother where she was. And distraction is a good way to deal with it. Yeah.
Dr.
Moving
Reichman?
on to other topics.
Right. Do you know whether those memories that Debbie's mother, more recent memories that she was unable to retrieve, are they gone or are they just there but irretrievable?
So the answer to that question resides in the cause of the dementia. So different causes of dementia have different impacts on our ability to remember. So let's take Alzheimer's disease, which, as Dr. Sinha said, is the most common cause of dementia. There, the memory problem is both being able to store new memories as well as being able to retrieve memories that have already been stored. In the second most common cause of dementia, which is generally due to small little strokes that accumulate within the brain, the problem is less in storing new information and it's more in retrieving it. So the nature of the memory difficulty does get determined by the disease that's causing the dementia.
Let's talk risk factors. You started on this a while ago and I interrupted you. Now we're going to come back to it. The biggest risk factors for contracting dementia are what?
Number one is age. Just by virtue of just getting older, you're more likely to develop a dementia. That's the number one. Often people are worried about genetics, for example, but the key is that, you know, if there's a history of dementias occurring at a very young age in your family, we're talking about your 40s, your 50s, there could be a genetic component, but generally dementias increase significantly in prevalence as we age, so that by the time you're over 90, there's at least a 1 in 3, almost 1 in 2 chance that you may have some serious problems with your memory. But the two things that we know for sure, and that's what Dr. Reichman was saying, the second most common type of dementia, those vascular dementias caused by problems that we have with our circulation that may lead to little strokes or kind of like heart disease in your brain, if you will, vascular disease. We know that actually by maintaining regular exercise and by maintaining good blood pressure control, you can reduce the future risk of those little strokes from happening in the brain. And just by doing those things, we know we can actually prevent dementias. And we've actually seen a lower incidence in that type of dementia over the last few decades, which is a great news story. The challenge is that more of us are aging and more of us are getting into that zone where we might develop another form of dementia as well.
Let's just be clear about this. When you say exercise, you mean 3 times a week, 20 minutes, get the heart rate up. Is that what you mean?
Yeah,
That's it.
And we're not talking about running marathons. We're not talking about bodybuilding. We're talking about going, I just say if someone can go for a walk every day or even a walk 3 times a week, just something to get the blood flowing, that's great. And those are the things that you can do.
If, Dr. Reichman, you abuse alcohol, if you abuse tobacco, are you more likely to get dementia?
So there's a strong association between cigarette smoking and increased risk for dementia due to both vascular disease, as Dr. Sinha just mentioned, as well as Alzheimer's disease. Alcohol, somewhat less clear whether it's associated with the 2 most common causes, Alzheimer's and stroke, as Dr. Sinha was just referencing. Less clear. People, though, who abuse alcohol, that are very heavy alcohol users, do get dementia from the toxic effects of alcohol. As well, people who drink very large accumulations of alcohol can have vitamin deficiencies that can also cause dementia. But these are much less common than what Dr. Sinha and I see routinely in memory clinics.
Given the potential change in legal status of marijuana in this country going forward, would you recommend for or against marijuana as it relates to dementia?
Steve, that is a great question to ask Dr. Sinha. I'm sure that he's got the best informed answer to that question.
That's a nice dodge. I love that. Okay, go ahead. You want to jump on it?
You know, that's a tough one. I haven't reviewed the literature on that lately. I think the key is that if you, I'm not sure specifically about marijuana, but smoking, is again associated with an increased risk. And again, it depends on what people are medicinally using marijuana for, right? And again, the toxic burden that occurs over time. So one of the key things we say is people say, should I drink alcohol? Should I not drink it? Should I, definitely don't smoke. We know that. But but when it comes to alcohol in moderation and just life in moderation with a bit of exercise and good blood pressure control, I think that will get you off to a good start.
I think it's absolutely adorable how uncomfortable both of you were with answering that question. But anyway, moving right along.
Glad you didn't ask me.
Should I have?
No.
No? Okay. Mind games, Sudoku, crossword puzzles, all that. We hear that makes a difference. Do you know if it actually does?
I think the research says that any kind of brain stimulation is good. I think the danger is that if you do one thing all the time, you tend to, learn how to do it, and so you're not stimulating your brain as much. So I think as you said, do variations of things, do a wide range of different things to stimulate your brain. Most important, of course, always being social interaction with other people. Yeah. That's critical.
We heard at the beginning of our conversation there are actually 16,000 people in this country who've been diagnosed with dementia before the age of 65.
Yes.
How early can you diagnose this condition?
Well, you can diagnose dementia really at any age, depending on what the cause of the dementia is. So,
is it possible to have it in your 30s?
Well, for example, a 16-year-old can be in a car accident and have a traumatic brain injury and then suffer dementia as a result of that kind of trauma. So You can get dementia at any age, again, depending on what the cause is. You could have a child, God forbid, with congenital heart disease who suffers a heart attack and then has what we call anoxic brain damage. So any individual who has an acquired decline in intellectual function, whether it's due to a neurodegenerative disease like Alzheimer's, whether it's due to stroke, whether it's due to a head injury, all of those folks can get dementia.
What about the annual general physical? People check your blood work, they check your urine, they check a lot of other stuff, your heart rate, your pulse, your blood pressure. Should they be checking for signs of dementia as well?
So there is some controversy about this right now, particularly in terms of screening, let's say, a more at-risk population, like over 65 or over age 70, because as Dr. Sinha said, it's very age-associated in terms of when the symptoms begin. By and large, I think what we recommend is to provide, particularly within the primary care context, some screening, especially if someone has subjective memory complaints, or what is very typical is a family member, an informant, an adult child, a spouse is starting to notice changes. It's critical to bring that to the attention of primary care doctor. So in the setting of either subjective memory complaints by the patient themselves or observations that are shared with the primary care doctor about an older parent or a spouse, that's when we do very strongly urge that some screening get done within that setting. And then if necessary, referral to a specialist like Samir or myself.
When you do a scan of somebody's brain, if it's there, can you see it for sure?
Well, this is the challenge, right? I think the key is we try and go off of people's symptoms, and one of the challenges, the biggest challenge I think we have is a lot of people just think that memory loss or dementia is a normal part of aging, which it isn't. And we know that a lot of people living in our community with dementia go undiagnosed because people just say, well, isn't dad supposed to get forgetful as he ages? And that could actually be a serious issue where there may be some reversible effects. So if someone does present, and says, I do have these issues, we have to understand if it's normal age-related memory loss, if it's another condition called mild cognitive impairment where you have subjective memory issues, and we can see it on objective memory issues on testing, but we don't actually see it impairing with your function. If someone has a dementia, most dementias you can diagnose with a good history and physical, but it's those rare ones or those ones where you're a bit confused by the diagnosis where imaging can help. But our guidelines in Canada say that we shouldn't be doing a scan for everybody with a memory complaint, and even with a general diagnosis of dementia. It's really there to help try and make that determination in terms of what type could this be, especially if that might influence treatment.
They say with everything else, if you catch it early, you've got a better shot at tackling it. Is that the same with dementia?
Absolutely, because there are some reversible causes of dementia. Sometimes I've had patients who are heavy drinkers, for example. We find out that they are displaying some symptoms of dementia, and these are folks who stopped alcohol altogether, and they're actually doing really well. And even some of those short-term effects actually improved. There are people who might have vitamin deficiencies, other things that you can reverse, and treatments that you can do that can change, such as treating someone's hypertension and other aspects. So getting in on it early is helpful, because even if there's no cure or treatments that can modify, you can still empower these individuals to make decisions and support them in their overall care moving forward.
Debbie, this is admittedly as much a political question I'm going to ask as a medical one, and that is, are we ready for this?
Well, we hope that we'll be ready for this if we have a national dementia strategy for Canada.
Do we?
We don't yet, but I'm happy to say that I think the stars are aligning, that we're getting to a place where we will have a national dementia strategy. So there's a number of things that have happened. There's a private member's bill that was put on the floor of the House of Commons last spring. Private Member's Bill C-233, and it's to have a national dementia strategy for Canada. So that has gone through first and second reading. It's been through Health Committee, and it's coming back to the House floor when the House reconvenes. So hopefully, early to mid-February, we will have a vote in the House to have a national dementia strategy.
And what does that strategy even look like?
So at the federal level, the three things that we think are most important to have in the strategy are research. So we need increased funding for research.
Not going to get any argument from these two.
Not at
Not
all,
on that.
I hope. Prevention, we talked a little bit about prevention, the importance of prevention, making sure we're arming Canadians with the information they need so that they can mitigate their risk, reduce their risk, and hopefully prevent the disease. And the third is, how do we help people who have the disease disease to live better along as they go through the course of their disease. Those are the three priorities in that.
We are going to follow up after this conversation with a more focused look at dementia in Indigenous communities, which obviously health issues in Indigenous communities tend to be different than in the rest of society for a whole host of reasons. But I wonder whether there is similarly a difference in the kinds of issues you deal with on reserve, with this as with everything else. Dr. Sinha, what about it?
Yeah, I actually do. I'm part of a group that where we provide geriatric services to the James Bay coastal communities, and so I spend a lot of time working with elders and older members of those communities who are developing dementia. And I mean, it's interesting because there are differences, but there are many similarities. One is you've got family members who are struggling as caregivers. You have patients who aren't sure what's going on. And I think the most tragic thing that I see is as people with dementia, especially if they have Alzheimer's dementia, are losing more of their recent memories and living in their older memories. The communities I deal with had some of the worst residential schools in Canadian history there. Right. And I have one or two patients in particular who are right now reliving those experiences, which is painful for all of us to watch. So it adds a different flavor in terms of how you diagnose, how you recognize, but one of the things, again, we're trying to do are these aspects, is how do we actually make sure that we can create dementia-friendly communities where there's good understanding, caregivers feel supported, and we can be there to provide the right sorts of care, especially when home and community care supports are very lacking in many communities.
Well, I was going to say, you're talking about remote places where just the regular resources that we take for granted, south of the French River are not to be had. So presumably this is an exponentially more difficult challenge, is it?
It's more challenging in the sense, well, one part is just making sure that we can get professionals in the community who can help diagnose and support community members. So we fly up to the community and provide specialist services, but we're building capacity amongst the local doctors and community health workers. The other thing we've done is we've actually worked in partnership with the Red Cross to train local men and women to become personal support workers. That way we can actually ensure that folks who are living with dementia, need more care at home, can remain in their communities, because that's one of the biggest fears in some of these remote communities, that if I'm living with dementia and I need to go to a more institutional setting, I have to leave my community forever. Right. So it's similar but different issues, but a lot of opportunity.
A couple of minutes to go here. Let's do what's at the top of your wish list. If the federal and provincial governments are listening to you, what's at the top of your wish list?
That everyone suffering from dementia, whether the cause is Alzheimer's or anything else, gets timely access to well-informed diagnosis and comprehensive care that meets the individual patient's needs and the needs of their families.
What does it take to get there?
Well, it requires quite a lot. I mean, I think Debbie touched on the need for a public awareness campaign. For one, as citizens, we need to understand the signs and symptoms of what dementia is so that we can bring it to the attention of our doctor as soon as possible. And as Debbie also was saying, we need to combat the stigma. We need to understand the sources of the stigma, and we need to support people in overcoming it. But I think this is what's really most critically important, is a public awareness campaign around this. And here in Canada, we've demonstrated that when we set our sights on big public health issues, we can be quite successful. Look what the country's accomplished in terms of combating cigarette smoking, what the country's been able to accomplish in terms of improving cardiovascular health, recognition of cancer and its treatment. So when Canadians put their minds to a serious public health challenge, this nation can accomplish quite a bit. And I would suggest that for my generation, the baby boomers, this is singularly the greatest public health challenge of our generation.
That feels like a good place to leave this. I thank all of you for coming into TVO tonight and helping us in this Alzheimer's Awareness Month. Starting with William Reichman, the President, CEO of Baycrest Health Sciences. We thank Debbie Benskowski, the COO of the Alzheimer's Society of Canada, and Dr. Samir Sinha, Director of Geriatrics at Mount Sinai Hospital and the University Health Network. Thanks, everybody.
Thank you.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.